Coming up on the Inside Indiana Business Television podcast, the latest weapons in the battle against the opioid epidemic, perspective on Eli Lilly's spinoff of Elanco, Indy-based OurHealth grows out of state, encouraging numbers from a Hoosier higher education report, Culture Matters spotlights the local United Way, a preview of the Indy Women in Tech Championship, and a look at the statewide workforce shortage. Welcome to the Inside Indiana Business Television podcast. I'm Andy Ober. A new initiative marks the latest effort to combat the opioid epidemic in Indiana. The effort will provide grants and other resources to boost education on abuse prevention throughout the state. Indiana Executive Director of Drug Enforcement Treatment and Prevention, Jim McClelland, joined host Gary Dick to talk about the ongoing battle.
Okay, you've been in the job again for about a year and a half.
Yes.
What are you seeing? Are you seeing areas where things are getting better? Any areas where things are more challenging?
We're seeing some signs of improvement. For example, Porter County reported last week that drug overdose deaths in that county are down 30% this year, first half of this year compared with last year. We've also seen drops at the other end of the state in Clark County. Last year, 2017, 33% reduction from 2016, and they're on track for a similar kind of decrease this year. This isn't happening everywhere in the state, but we are encouraged when we see signs like that. And then the two events that you mentioned a moment ago are good examples of how people across the sectors are coming together. They're tackling this in various ways. We're seeing that at a local level with Raleigh. We're seeing it more at a statewide level, and certainly with the Chief Justice's summit yesterday. While we're seeing some wonderful examples of how all branches of government are really coming together. They're aligned and focused on doing what each can do best to solve this problem.
I want to talk about that all-hands-on-deck approach in a moment. But first of all, you talked about the positives. As we were talking off camera, the challenges and what makes it so difficult, the infusion of things like meth and some of these other issues that really complicate things.
Yeah, you know, this crisis really got its start about 20 years ago with overuse of legally prescribed pain medications. Now, those opioid prescription rates are coming down. From 2013 to 16, they dropped 21% in Indiana. They're down another 9% this year. Now, we still have one of the higher opioid prescription rates in the country, but the trends are positive. But then what's making this it's such an incredibly complex problem, and what's exacerbating it is the growing prevalence of fentanyl and other synthetic opioids that are very potent. Most of this is coming in. The fentanyl's manufactured mostly in China. A lot of the black tar heroin is still coming up from Mexico. A lot of it is laced with fentanyl. We're seeing an increase in counterfeit pills that contain fentanyl. They look like prescription pain pills, but they're not. Bottom line here is you buy on the streets, you don't have any idea what you're getting. And so it's a constantly changing problem that requires a lot of resilience on the part of everybody who's trying to deal with it. Huge
human toll here, obviously, but the impact on the business community is substantial.
It's huge. You know, the Kelley School did a study. They really have separate. There are two different pieces to this. There's the direct economic impact, which they're estimating at about $1.5 billion a year. And then if you calculate the lost earnings of people who die from this, it takes it up to about $4 billion a year or $11 million a day. So the economic impact is huge. And then we have employers who are having a hard time filling vacancies because they can't find enough applicants who can pass a drug screen, or they've got employees or family members of employees who are affected by this, and it takes its toll.
Give us a quick example. Belden in Richmond,
yes.
An example of a company that is taking proactive steps.
They are, and they did this on their own initiative. They launched this initiative back early this year, and because they were having so many people who weren't passing their initial drug screen. And so what they're doing is, if someone fails that drug screen, they offer to connect them with treatment. And they have relationships with a couple of treatment organizations over in the eastern part of the state, and they will connect them with treatment if they adhere to the treatment protocol. In essence, Belden is guaranteeing them a job. So it's a great solution for them, and it helps re-engage people who are in recovery in the workforce, and we really need to do that.
Only have 30 seconds, but I want to get back to Raleigh. That announcement this week, another coalition formed to attack this issue. What's Raleigh rally all about? What's it going to do?
They're going to provide some additional resources. As you mentioned, their first one is focused on the Indiana Workforce Recovery Initiative the Wellness Council of Indiana has undertaken. That's going to help employers with tools to help them understand better how they can respond to this, how they can recognize the signs, and how they can and where to find help for their employees.
Yeah, I know a big focus will be access, increased access to treatment as well. Jim McClellan, thanks very much. You're a busy guy, big job. Thanks for being here.
Still to come, an Indiana health company expands out of state, and a progress report on Indiana college graduation. But first, Indianapolis-based Eli Lilly is spinning off its animal health unit into a separate, publicly traded company. University of Indianapolis Associate Professor of Finance Matt Will calls the Elanco decision long overdue. He came in studio with more perspective.
Lilly has been thinking about what to do with Elanco for a long time, announcing this IPO this week. Good move?
I think it's a great move, and it's part of what I call a deferred maintenance package. You know, Lilly went through a massive restructuring, a lot of voluntary retirement program where offers were made, and then they're going into phase two, which is restructuring the company. You know, this year they've acquired 2 different oncology purchases. They spun off their liver disease molecules, and now they're looking at selling Elanco. Now they've tried hard to make this work. 2014 they bought Novartis Animal Health. They pumped a lot of money into it, and I think Wall Street has wanted to see this for a while. Mm-hmm. And when you saw the reaction on Wall Street, which was the stock jumped to a 17-year high, mm-hmm. I think Wall Street likes what Dave Ricks is doing at Lilly, and I think it's a win-win for both companies, actually.
Elanco basically a new headquarters in Greenfield, a beautiful new structure out mm-hmm. there. Been doing some really world-class work out there. Your thoughts on the impact the IPO will have for Elanco?
This is fantastic for them because you got to remember that Lilly is under the umbrella of the FDA. Mm-hmm. Okay, there's a lot of shackles that are attached to them for the things they do. Elanco has to live by those rules, which are not as rigorous for the animal health division. So now that they're going to be out from under that, I think you're going to see a lot of innovation. And where Elanco may have struggled financially, by themselves, I believe you're going to have a really successful company.
It's too early. You can't tell about jobs and that kind of thing. But as you look at this and the potential for positive things at Elanco, not only in central Indiana, here west central Indiana, they've got a major plant in Vermilion County as well. Mm-hmm. The potential could be there for those things to be positive.
If I were an employee of Elanco, I'd be excited. Because Elanco, their employees haven't got bonuses in years because they are under a different structure than the corporate Lilly is. And so when they restructure this company, they become more innovative. You're going to see a different mix of employees, more risk-taking, more responsive to the customer. I mean, you got to be excited if you're at Elanco right now for what the prospects hold.
Yeah, we'll see how this unfolds as we wrap up. How does this play into the whole strategy at Lilly and what Dave Ricks is doing at Lilly, continuing to look at collaborations and acquisitions? Yeah. We see that continue?
Wall Street loves Dave Ricks. And this is why, because the guy is focusing on what is their core business. It's R&D, it's marketing, and you know what their new core niche is? Investment banking. They're really getting into the buying and selling of compounds and businesses, and they've developed an expertise there. So I think it looks good for Indiana that Lilly is a buyer rather than a seller, because we never want to see that happen. So we're in good shape here.
All right, Matt Will, UIndy Associate Professor of Finance. Big news this week with Lilly's decision to kind of spin out, if you will, Elanco Animal Health. Matt, as always, thanks very much.
My pleasure.
Later in the podcast, encouraging numbers from a college graduation study and our monthly Culture Matters segment. But now, Indianapolis-based OurHealth, among the nation's largest near-site healthcare clinic networks for employers, is growing out of state. The company is looking to open multiple clinics in Cincinnati and hire dozens of workers. President and co-founder Dr. Jeff Wells joined Kylie Valletta in the Business of Health with more.
So Cincinnati marks your third major market expansion, really highlights some impressive growth for your company, but you said you've also made some really big investments in data recently. So what's the significance of that?
We have. So Kylie, as you know, part of the mission of our business is to really radically simplify the healthcare experience for patients. And as we work with employers, one of the most important things that they want to know is, can we prove that we're really making an impact in the health of their employees and ultimately driving savings? And the only way to do that effectively is to invest in the data. So in a really secure fashion, we want to be able to look at what's driving both healthcare cost and just impact in health. So we've made really large investments in our analytics capabilities, and we're really proud to be recognized. The Mirror Awards earlier this year, we were honored as one of the Corporate Innovators of the Year. Just a testament to a great team, and that's really helping us sort of prove the return on investment and impact that we're delivering.
And some of your employer clients have on-site clinics actually on their campuses, some of the larger employers that can support that kind of investment. But you're also seeing more mid-size and small companies come on board.
We have. So at the end of the day, one of the most important things we can do is lower the barriers to accessing primary care for our customers. And what we realized is when you only have an on-site clinic, the employer has to have sufficient size and scale, as you mentioned. And so we really developed a market-leading solution that we call My Clinic. And Indianapolis was our first market back in 2014. We've expanded to Charlotte, North Carolina, and that's the same solution we'll be taking to Cincinnati. And that allows mid-size and smaller employers the ability to join and realize the same benefits.
And some familiar names in central Indiana, some employer clients. You have City of Fishers, City of Indianapolis, Ice Miller, One America. What's the big sell? What's the key attraction for employers?
Yeah, we're really fortunate to work with great organizations in central Indiana, and I think the big sell for them is a combination of improving the health and well-being of their workforce and those families, and being able to drive lower cost of healthcare.
So of all the cities you could have chosen to expand, why Cincinnati in particular?
Yeah, Cincinnati shares a lot of the same features as Indianapolis. It's a really successful business community. It's a growing market. They're similarly challenged with high healthcare cost, and employers there are looking for innovative solutions. And so we believe we can deliver the same type of impact there. It's also close, so our team can get there and provide good service for those customers.
So what's next for OurHealth? Do you focus on markets that you're already in, or do you look to more new markets?
Yeah, so we believe that healthcare needs to be changed across the country, and we think that we have a team and an approach that can really make a difference for patients, deliver more value for the employers that we work with. So our first priority is always to serve our current customers in the markets in which we already operate, but over time we certainly have aspirations to grow into a number of markets across the country.
And you have no problem bringing clients on board. What is causing the growth and so rapidly right now?
Yeah, most employers that I talk with continue to be frustrated by their healthcare costs going up every year. And as they look around, they recognize that their employees, due to chronic health conditions and challenges, are both missing work or not necessarily as healthy as they could be, and they're just not finding solutions in many of the traditional healthcare offerings. And so I think that's the big driver, is employers are motivated to try to find a path forward that can yield improved health for their employees and savings. And we're part of, I think, that future.
And one thing you mentioned off camera, we have just a few seconds left, but to think of OurHealth as standing in front of a traditional healthcare plan, not necessarily on top of.
Yeah, that's exactly right. We don't replace traditional health insurance. When we work with employers, they could still have a great Anthem or United Healthcare or Cigna benefit, but what we can do is offer almost like a first stop for those employees. So it's easier access for wellness services and primary care, and then we can help those employees when they need care beyond us use their traditional insurance benefits to find great care providers.
Well, Dr. Wells, thank you for being here. Good luck in Cincinnati, and thanks for sharing the news with us first.
Oh, really appreciate the opportunity, Callie. Thanks.
Remember, you can catch Inside Indiana Business Television on stations throughout the state every weekend. Head to InsideIndianaBusiness.com to check listings. Still to come, the United Way takes our Culture Matters spotlight, and a pro golf event makes its return to Indianapolis. But first, new data shows more Hoosier students are graduating college than ever. In addition, the 2018 College Readiness Report shows Indiana high school graduates are more prepared for college than ever before. Higher Education Commissioner Teresa Lubbers weighed in on the results in this week's Eye on Education segment.
So positive news in these reports. First of all, college completion, very important. Obviously, a big push to get more degrees here in Indiana. Talk about the college completion numbers.
Well, the goal to going to college is not to go to college, it's to complete college. And so everything that we're doing is focused on making sure students are successful. All the trends look good. Yep. Now, that's not to say we're where we want to be. We have work to do still, but all the trends in the right direction. We're getting more students to actually complete college once they enter at both 2- and 4-year institutions.
Anything that you can point to or things you can point to maybe driving the improvement?
Well, the focus on colleges now, it's a very student-centered focus. This is about student success. So we don't pay colleges and universities based on the number of students they enroll. We base our funding formula based on the number that complete. And we know that students come to college with an aspiration to get a job. And so we're making sure that they complete and can get that job. We've seen really great improvement in students completing on time, which of course saves them time and money.
Mm-hmm. And importantly, we're talking about here, especially with the evolving workforce and the challenges in the workforce and companies attracting talent. We're talking about 4- and 2-year college degrees here. Credentials beyond high school, right?
Yes, when you hear me say college, think quality degrees and credential beyond high school and the alignment of those credentials with the world of work. And so we talk to employers on a daily basis about what their needs are, and we try to make sure students, both those graduating from high school and those returning adults, understand what is needed in the economy today.
Do you think that message is getting out to the broader population around the state of Indiana? Great 4-year institutions, but the 2-year associate degrees and those types of degrees are very important in this economy.
It's especially important as they're aligned to the needs of the economy, as you've said. We think it's about the right fit, so you're never going to hear me not advocate for quality 4-year degrees, but I'm going to also advocate, and with the Commission will, for certificates, industry certifications, associate degrees, a full range of options that are aligned to the needs of the economy.
Obviously, a very important piece of completion is being ready for college when you get there. Another report out shows that readiness for college is improving double digits.
The transition between high school and college is very important in making sure that students are ready. And we measure that in several ways. And one of the ways are how many students actually enter college with some sort of credit. We're one of 4 states in the nation where actually more than 50% of students enter college with some sort of college credit, dual credit or AP. And we're actually at 61%. So that's a great measure. We know students are then taking college level courses and are more prepared to be successful. The other measure is, did they need to have remediation when they got there? And we've seen a tremendous improvement in that. 4 years ago, 28% of students entered primarily Ivy Tech needing remediation. We're now at about 13%. So we're making progress both in terms of how we deliver those programs when students arrive there and making sure they're better prepared when they get to college.
Yeah, and I know you're going to be coming out with another report, an important report, equity report in the week ahead.
We are. We have a goal of Indiana that 60% of Hoosiers would have a quality degree or credential. We're at about 42% right now. We're making improvements, but that's still below the national average. There is no way for us to get to that number without doing a better job with the changing demographics and making sure that students of color and low-income students are successful. The good news is we know how to do that in one very effective way, and that's through the 21st Century Scholars Program. Our scholars are going to college at a higher level and being more successful than many times the population at large and certainly their low-income peers.
Yeah, we only have about 30 seconds left, but as we wrap up, your view of the state of higher education in Indiana now, certainly it's an evolving and a changing marketplace, if you will. How would you assess the state of higher ed?
Good and improving and needs to get better.
Yep, very good. Succinct. Thank you very much, Teresa Lubbers, the Commissioner for the Indiana Commission for Higher Education. Some great numbers, and we'll look forward to having you back on the show soon.
Thank you.
All right.
Later in the podcast, a preview of the Indy Women in Tech Championship and a look at Indiana's workforce shortage. But now, the United Way of Central Indiana opened its new renovated headquarters last year. It's designed to be a modern, open-concept design to maximize its space for staff, partners, and volunteers. The organization is the subject of this month's Culture Matters segment with First Person Advisors Managing Partner Paul Ashley.
United Way of Central Indiana, certainly a staple in the community. The nonprofit community does so many things in the community. Their office needs, changed from a building designed back in the 60s. And they really, as I said, took a collaborative, collective approach to designing the new space.
Absolutely did. It's a great example of where symbolism has been intentionally used. buy a space to project what they need from their employees in the community they serve. A great example is the senior leadership team sits physically in the middle, and they're in offices that are completely glass, almost like a fishbowl, signifying that they're the heart of the organization, they're there, that they're accessible and they're transparent in how they lead, which is pretty cool.
Really striking when you walk in. It's colorful, very modern looking, and it really is a striking design.
It is, and really another good symbolism example is when you get off the elevator. You come in and you see the social hub. Well, why is there a social hub? They're trying to create intentional collisions where people on the team can collaborate. They come out of their offices and they're there, and they can also collaborate with the community they serve. And it's a place to just host gatherings and be collaborative, which is intentional.
And much like the office space itself and the design and the idea there, a lot of the day-to-day work is really employee-led.
It is, and the leadership team has said we want our employees to be responsible for the culture we create, because they in fact are the culture. And so what they do is they facilitate grassroots efforts where employees are leading ideas. A good example of that is they have different committees. So they have the Well United Committee, the Fun United Committee, the Kudos United Committee, the Serve United Committee. These are all employee-led. There's not a bunch of senior leaders pulling the strings. They just give them the capability to do what they want to do.
And what I think is interesting here too, this is a nonprofit.
Yes.
Obviously, we talk so much about culture and about the need to attract and retain talent. That's certainly no different in the nonprofit space.
Yeah, and you could argue it's as competitive as it's ever been. And historically, what's happened with nonprofits is they've tended to have compensation that's a little bit lower and benefits that are higher. What we've seen in our benchmarking is that's really just coming together and more like the for-profit world. But what they've done is they've created special benefits because the work they do is so hard, so demanding, so emotional, trying to fight poverty and sustainability in Central Indiana, that they've created other special benefits like mental health movie day and other things that are, the seventh inning stretch that they do, other things that you just wouldn't see typically, and it's a help them win the war on talent. And I do think the space, that's done to attract and retain the talent they need to be the organization of the future that they want to be.
You think that more nonprofits, we've seen others do it as well, but more nonprofits may follow this idea, this model, and really begin to engage very intentionally in how office space is designed?
I totally think so. I've got another example. Serve on the board of Outreach Inc. Outreach just built their new building. It was April of 17 that it opened, and that was done very collaboratively with the staff. What do we need to have design? Where do we put offices? Where do we put service areas? How is it? And I think you see that a lot, and that's bleeding into the for-profit world as well in terms of space design.
Yeah, and the name of the segment, Culture Matters. I think each and every segment we do, as you talk to companies and organizations, that comes through loud and clear that culture does matter. Culture
does matter, absolutely, and giving employees a voice in that and not just lip service is when people win.
All right, Paul Ashley from First Person. As always, some great perspective. Thanks for joining us.
Thanks, Gary.
All right.
Still to come, a deep dive into Indiana's workforce shortage. But first, the Indy Women in Tech Championship returns to Brickyard at the Crossing in Indianapolis in August, a month earlier than last year. More than 140 LPGA players will be competing for a share of the event's $2 million purse. Octagon Vice President of Events Harry Hardy joined Bill Benner with a preview in Inside Indiana Sports.
Before we look ahead, the first year of the IWIT, you were pleased.
Yeah, we were very pleased. I remember September 2016 announcing the event on the Yard of Bricks with the folks from IMS and Guggenheim, and we had a year to pull it off, and it's, you always want more time, but we were able, with support from the Sports Corp and our local organizing committee, pull off an incredible first year event. Very good crowds, very good reception from the players, and it set up a really good foundation for year 2 and beyond.
And this year we'll expand from 54 holes. Last year they had an international event that they had to cut it short, so it's 72 holes.
Yes.
And back at the iconic Brickyard, which is, again, you were saying off the air, one of the most distinctive golf course
Truly.
venues in golf.
It really is, and we try and celebrate that. I mean, why hide that you're at this incredibly iconic cathedral sports venue? And with that being said, we rerouted the golf course last year, so we actually finish on the 4 holes inside the track. The players loved it, having the pagoda looking down on us as Lexi hold that winning putt for a check for $300,000 and the first ever IWIT trophy. We kind of celebrate that racing world and golfing world colliding at what is truly the most unique event or venue in professional golf.
Guggenheim back as the title sponsor, but under a slightly different name.
Yeah, the Group 1001 company name is driving this event this year. Dan Tauris, the CEO there, is continuing to lead the way in terms of the sponsorship around this event and the investment into the city of Indianapolis.
The mission of the tournament is the name inspired women to get involved in tech and STEM. And as part of that, you'll have a summit that takes place a couple of days before the tournament begins.
There's events almost every day during the week. It's such a unique proposition to have. You know, Dan Tauris and Greg Ballard's vision behind this was to put the cause first before the company almost. So Indy Women in Tech Championship is a very unique name in professional sports, and will range from a Women in Tech Summit on Tuesday to 1,000 kids going through hands-on STEM activities at our Eureka Exchange.
That's fantastic.
Every day that week is something around the mission, and then we finish over the weekend with the world's best female golfers.
And if you're a golfer and a foodie, you have another event called Bite.
Bite, presented by our friends at Indiana Grand Casino. It's a 2-day food festival, so you can come out, watch some golf, and then as the last putt goes in on Saturday night, we'll fire up the band and enjoy some of Indy's best restaurants.
Yeah, and again, as you look ahead, there's still some volunteer opportunities in case you want to go out and have a real close look at the activity.
We need around 750 volunteers to pull this off, and Indy's known as the sports volunteer capital of the world, and we still have some opportunities. So we welcome everyone to come on down. It's a great way to be inside the ropes and get a first-hand view at the incredible athletes that we'll have.
And also a few openings in the Pro-Am that will take place the day before.
Yeah, the Pro-Am, Wednesday of our tournament week, you get a chance to play with the LPGA professionals on the tournament golf course. Really a unique opportunity that, it's kind of like being on the 50-yard line, during the game. Like you're right there. You get to play with the pros, and they play the same tees as the gentlemen. So it's you get up close and personal.
Yeah, and I did that last year. And I tell you what, the women that I played with could not have been more personable and more enjoyable to play with. Tournament long term is, what's the prognosis for that?
Yeah, we announced a 3-year commitment to be at the Brickyard, so this is the 2nd year of that, and we're talking about the future, and it's just a fantastic place to do a professional golf event.
Well, Harry, glad to have you in Indianapolis, and best of luck in the event coming up in a couple of weeks.
And finally this week, when it comes to economic development projects, perhaps the biggest issue right now is labor availability. How is the workforce shortage impacting companies' decisions to invest here, and what can be done? KSM Location Advisor CEO Tim Cook and President Katie Culp weighed in for our Eye on Economic Development segment.
Workforce. We're talking about it all of the time across a variety of areas. Everybody's talking about, when it comes to economic development, how big is this workforce issue?
It is huge, and it's national. I mean, Indianapolis, the state of Indiana are not the only ones being hit, but when you look at the unemployment rates, virtually everybody who wants a job has one. And so employers are having to do a lot of different things. We're seeing a lot of new investment from state and local government, and it's needed because it's such a big problem.
Yeah. And Tim, I think that's a good point, is the fact Indiana is not alone. I mean, it's an issue in a lot of different places. Doesn't make it any less of a daunting challenge. So both companies to keep talent, but communities, states, and localities have to come up with innovative ways to attack the problem.
Yeah, I think you're seeing that, and I think the other thing that you're seeing employers trying to be more creative on their own, whether it's increased amenities. We have a lot of clients right now, especially in the tech space, that cover 100% of their health care. Those types of investments are necessary now, to Katie's point, because unemployment is at such a low, they're trying to come up with anything they can to try to solve the problem.
Yeah, and a number of communities are trying to get innovative in doing programs. I know one of the things I'll start with you, Tim. Shelby County seems to be really creative and proactive in doing these things.
Yeah, so they have a program that's called Advantage Shelby County, and it's basically a 2-year scholarship to an Ivy Tech school to take them through that process, be able to get through that debt-free if they make a commitment to stay in Shelby County. We've had a couple of clients that have looked at it, and it's really gotten their attention. And I think it's a good example of the type of creative thing that you're seeing counties do and folks doing at the local level.
Yeah, in Marion County, Katie, you look at a number of initiatives that, again, are being proactive and really creative.
Yeah, and you think about, it makes sense that at the local levels, perhaps where you can even be most impactful, because even you look at a Shelby and Marion County, they're so very different. So I have the opportunity to be on the Employee Indy Board, which is the workforce development agency. And one of the things that Mayor Hogsett said at one of our first meetings, which I thought really captures the whole thing, is, what we need people to find a job. It's ABC, a job, a better job, and then a career. And so they've really developed programs to target populations that haven't always been first of mind when it comes to employment opportunities. So Mayor Hogsett and his team just rolled out Indy Achieves with Employee Indy, which is an opportunity to increase the education levels, whether that be college or VOTEC or some type of certification, and put real money behind that. There are some programs through the chamber. There's all sorts of acronyms, JAG and all of these other things, but it's really to target those who may be at risk for falling out of the workforce or for not going on to continue to education, and to link them up with opportunities. And I think it's that type of partnership in the private sector, the public sector, and that relies on business as well, is where you really start yielding a lot of benefits. And you've got to have that holistic approach.
Yeah, a lot of effort at the local level. Johnson County with the Central 9 Career Center is another great example of what's happening at the local level. Tim, Governor Holcomb has spent a lot of time talking about this workforce issue and trying to get some workforce development programs engaged around the state. Success?
I think it remains to be seen. They've allocated a lot of money to it. They've got Skill Up. They've got a number of different programs that they're investing money in. I think it is kind of a work in progress to see what kind of success they're going to have, but it's certainly for no lack of effort, because I think you're seeing it at the legislative and at the executive level.
And one of the really exciting things I think about Governor Holcomb's initiative is you see a governor early in his administration that said workforce development is a priority and we're going to put some money behind it. In May, he even anteed up double, I think, the funding for one of his programs, and so he's got this workforce cabinet. I think the trick is, like any of these things, we've got to get, it's not just government's job, it's not just social services job or employers, it's getting all of those groups to work together in an effective way, and sometimes that needs to be nimble. What works in one small community may not work as well in another.
Yeah, got to be a collaborative effort. Are we seeing, are we to the point now, because Indiana gets a lot of attention for having great workforce, cost of living, quality of life, all those positive things, but at some point, does the workforce issue become something that is going to maybe strike Indiana off the list for economic development deals? Or have we seen it happen?
I don't think it's happened yet, because again, I think so many similar communities look the same. What I think is interesting is some of the markets that are your first go-to spots, whether it be for industrial or office, they're starting to be perceived as being kind of tapped out. So other parts of our region that maybe saw less development before are starting to get more interested looks. And so if there's a silver lining, maybe that's it.
Yeah. And I think you have to break it out between kind of those entry-level types of positions and then some of the senior positions. And I think you are seeing that with some of the tech companies not being able to find those senior type of skill positions and having to go outside the state. And maybe in some cases that is taking Indiana off the list.
Will, is this a situation that's taken a while to get into? It's going to take a while to work its way through it.
Yeah, if it were an easy problem to solve or to fix it, someone would have come up with it by now. Yeah, but the market, I think everybody expects the market may not stay where it's at forever, so it will change.
And we have a governor that's actually committed to it in a big way, not just with talking about it, but also spending the money on it.
Yep, a big issue, no doubt. Workforce development, the labor market in Indiana, all over the state of Indiana. Some great perspective, as always. Tim Cook and Katie Culp, thank you both very much.
Thanks,
Gary.
All right.
That wraps up this week's Inside Indiana Business Television podcast. Remember, you can find all of this week's TV segments, as well as the top business news from throughout the state, at InsideIndianaBusiness.com. While you're there, you can also subscribe to our platform of free e-newsletters. This is Andy Ober for Inside Indiana Business.